Hey y'all, I'm going to tell y'all a little bit about what we did for our community project. For our community project, we did skin cancer prevention and detection in adolescents. If you didn't know, skin cancer is one of the most common cancers in the USA. It's so common that 1 in 5 of us will develop some form of skin cancer throughout their lifetime. Now, the people that are at the highest risk for this are going to be those people with blonde hair, red hair, blue eyes, fair skin, excessive sun exposure, they're getting radiation already, or they have a family history of cancer, or even as small as they have a large amount of moles and freckles. Also, another way to look at the risk factors is by what your UV index is for the day. Now, if you don't know, your UV index is how much of the sun rays are going to be actually hitting the Earth's surface. And so we have a line graph here that goes from 1 to 2, 3 to 7, and 8 to 11 plus. Now, if you go to your Weather Channel app or to the weather, you look at the Weather Channel on TV or whatever you do, they will tell you what the UV index is for the day. Now, if you have a day that's 1 or 2, then you don't really have to worry about putting any protection on when you're going outside. Now, when you get to those 3s, 4s, 5s, 6, and 7s, that's when you need to start avoiding those midday hours, which is the hours between 12 to 3. And you need to be wearing your sunscreen, your protective clothing, your hats, your sunglasses, stuff like that. Then when you get to the 8s, 9, 10, 11, and plus, this is when you really need to try to avoid those midday hours if possible. And if you do need to be outside or you're required to be outside, try to be in the more shaded areas. That'll help protect you a little bit more. And then be sure to have your sunscreen on, your protective clothing, your hats, your sunglasses, things like that, because those days are going to be the days where you have the higher chance of getting sunburns or eventually developing skin cancer, unfortunately. Now, one way to, for signs and symptoms of skin cancer is by following your ABCDEs. These, ignore the picture drawing, I'm not an artist at all, but we start with A. A is asymmetric, and so obviously your mole or your spot is not going to be symmetrical. You won't be able to divide it evenly. Next, we have B for border. You're going to have a ragged or irregular border. It's not going to be that smooth, defined border. With C, the spots aren't going to be green, but that's all I had at the time. You're going to have a spot that is darker and lighter in different areas. Could have some reds, some blues, some blacks, whites. It's just not going to be a solid, definite color. Single color. D stands for your diameter. This is going to be when your mole goes from a larger size to a smaller size. And so your diameter is not all one equal size. And then last is E, and that stands for evolution. It's when they go from a smaller size to a larger size, or a larger size to a smaller size. Or they could go from being flat on the skin to raised up. Now with that, there's 3 different kinds, prominent kinds of skin cancer. First, you have your basal cells. Your basal cells can be found in your upper part from like your shoulders, upper back, and up. And these are going to be small, pearly, translucent bumps. They will have a thickened scar tissue-like look. And they will also crust over. Next is squamous, and these happen once again on like your scalp, your ears, your head, your face, also your lips or your lower legs. And these are going to be those red, scaly, flat patches. And then last is our most dangerous one. This is melanoma. This can occur in any area, but for women, it's more common on your lower legs, and for men, it's more common on your chest, abdomen, and back. These have that sudden appearance change. So I'm not talking about over 5 years, you have this mole that slowly started growing bigger. These are going to be like over a couple months. It's gone from a pin size to a quarter size. It's going to be apparent. They're also going to have a dark spot within them. They're going to change color and size. These are going to be the more painful, itchy ones, and they also could start to bleed or ooze. Now, with some prevention, you want to stay away from those midday hours, like I was saying. You want to block that sun with some sunscreen. You want to cover up with protective clothing, and you want to speak out. Now, if we're talking about the protective clothing and the sunscreen, here I have some examples. Protective clothing, this is just a PFG fishing shirt, but when you look it up, it has a UPF, which is ultraviolet protection factor, of 50 plus. And so it is protecting your skin from 50% of those rays. Next, yes, it's a little obnoxiously large, but it gets the point across. Your hats to cover you up during the sun, exposure times. And then also we have our sunscreen. Here is what they recommend, which is the 30 SPF, which is sun protection factor. They also have 50, 85, 75, even 100. And then here's just baby sunscreen. Another little acronym to remember when you're wanting to help speak out or teach somebody or remind yourself about different things about skin cancer or sun awareness, use AWARE. You want to avoid the unprotected UV exposure. You want to wear those protective clothing. You want to apply that sunscreen. You want to routinely check your skin, and you want to educate everybody. Now, back on that routinely checking your skin, this is so important. Not only do you need to routinely check your, examine yourself for other factors, but you need to watch those moles and those freckles or spots that come up, because it's better to catch this early than to catch this years down the road because you weren't routinely checking yourself. And then once again, to educate not only yourself, but to educate others, because it does happen to 1 in 5 people. That is pretty much all I have. All right, so I'm back. This time we're going over our handout. So, of course, once again, it's on skin cancer prevention and detection in adolescents. To start out, on this side we have our risk assessments for skin cancer, the things that I already stated, the fair skin, excessive burning, family history, decreased immune system, skin lesions, and then here is the blown up version of our UV index of when you can stay outside safely, when you need to seek shade, when you need to have shirt on, sunscreen, hat, when you need to avoid those hours, when you need to make sure you absolutely have a shirt, sunscreen, and hat on. And then here in the middle, we have our signs and symptoms, the large brownish spot with dark freckle, a mole that changes size and color, irregular borders, portions, painful spot that burns or itches, dark spots on your palms, soles, or fingertips. And then here we have another picture of our ABCs. That looks a lot better compared to my drawings. I'm not an artist at all. Here's our prevention. You apply the sunscreen of 30 or higher SPF 20 minutes before going outside, reapplying it every 2 hours, wearing your sun protective clothing of UPF 50 plus, wear your hat or sunglasses. Don't use tanning beds. I forgot to mention that in the poster, but tanning beds increase your risk of getting skin cancer by a lot. You are purposely putting yourself in a bed where you're getting all those UV ray exposures without any protection. Yes, it's nice to look tan, but is it going to be nice in a couple years or 10, 20 years down the road when you get skin cancer? So you need to think about that. Instead, what you could use is the sunless tanner, the fake bake, whatever you want to call it. That is a lot better for you. And then here's our sun aware to avoid, wear, apply, routinely check, and educate. Hold on. Okay, and then here are some facts. Skin cancer is the most common cancer in the USA. 1 in 5 chances you'll develop in your lifetime. Approximately 9,500 people are diagnosed with skin cancer every day. Approximately 20 people will die from melanoma every day. And the red and blonde hair individuals have a higher chance of getting skin cancer. And then here I found 2 little graphs of skin cancer by ethnicity. Caucasians are 20 times more likely to get skin cancer than African Americans, and African Americans are 4 times more likely to receive a diagnosis of melanoma after the cancer has progressed to the advanced stages versus the Caucasian individuals. The survival rate for melanoma over 5 years is 69% of African Americans will survive and 94% of Caucasians. And then by sex, women have a higher risk of developing melanoma more than men until their age of 49, and then after the age of 50, men are more likely to develop it more than women. Melanoma incidence among older white male is 168 cases per 100,000. And then we have our resources right here. Well, that's all I have for y'all, and I hope y'all learned something or y'all are a little more aware about how to protect yourself from skin cancer.